Diabetes treatment has changed dramatically in recent years due to digital devices for blood glucose monitoring and insulin delivery. Now, they are being networked smartly. Mariel Wagenknecht has had the metabolic disease since childhood. She used to have to measure her values up to 10 times a day in the classic way. Now, a sensor under the skin takes care of this. It sends the results via the smart transmitter to an app on the smartphone or smartwatch. The transmitter, which is attached to the skin with a patch, also vibrates when glucose levels are too high or too low.
Today with my CGM system, with my continuous glucose monitoring system, I get a new value every 5 minutes on my smartphone or my Apple Watch. So compared to earlier times, that's 280 values more per day. So I have a better overview about my values.
During continuous long-term measurement, more data is collected. In addition, there are many external factors that influence the treatment of diabetes. It is almost impossible for the patient to record all this in the traditional paper diary. Many practices also fail to collect and evaluate data. As a result, treatment goals cannot be achieved. Experts, such as Professor Bernhard Kulzer, ask themselves the questions. How can doctors be helped to get good information about the patient as quickly and efficiently as possible? What is their current condition? What do I have to discuss with them? What are therapy goals that have not been achieved? Software from Roche Diabetes Care can help to answer these questions. It structures data from glucose measurement systems, insulin pumps, and digital insulin pens, evaluates and visualizes them in an understandable way from devices of different manufacturers. Clearly arranged curves show values and their progressions. A traffic light system indicates where action is required, a solid basis for therapy actions.
In
our medical practice, digital health management is the basis for patient dialogue. After the assistant or diabetes consultant has imported the data, we look together at the data on our monitor to talk about obvious problems.
Zu erkennende Probleme zu sprechen.
If a doctor's office is equipped with digital technology like a software, it helps me to discuss it easier with my doctor or my diabetes nurse. So within a few clicks, we have an overview about my values and can take decisions directly.
Product manager Dennis Slavik emphasizes that a little preparation work is needed before the digital diabetes management solution bears fruit for patient and practitioner.
To implement all this in the daily routines, it is important that you have an intensive service. The practice must be accompanied and supported from the installation through various trainings to the optimal use during the patient talk. So HCPs have more time for the patient talk.
Once the team is coached, the software is optimally used in a structured process. Managing Director James Fisher emphasizes the advantages and goals of this personalized diabetes management system.
In our Pro-Value study, we were able to show that when we use this data in a structured manner to address blood glucose levels, we have the possibility through the Pro-Value study, for instance, in using these digital tools to reduce blood glucose levels an average of 0.5% with these patients. And that is a very significant value, which compares well with anything that the most modern insulin therapies are able to achieve. But the next step for us is to expand that picture of the patient beyond the diabetes values, in that we're going to create interfaces to other software that doctors use and that the healthcare system uses, so that when the doctor and the patient meet each other, they look not just at the diabetes values, but also at nutritional values, EKGs, blood chemistry, all of the things that impact ultimately the patient's diabetes status.